Hello, this is Mary Corcoran, and I'll be talking with you today about conceptually based research questions and how to design them. Specifically, I'll be touching on the role of theory in clinical research, or how clinical research influences theory and theory influences clinical research. I want to talk about the specific structure of a theory, because theory plays such a critical role in clinical practice and research, and you can best understand that role by examining the specific components of theories. And then finally, we'll talk about theories and scientific reasoning. Clinical research is a systematic method for evaluating the effectiveness of our treatments. And clinical research is also useful to establish a basis for generalizing about interventions beyond a specific patient or patient group. The ultimate goal is to further intellectual progress by contributing to the scientific base of practice through the development of theory. Theories are created out of a need to organize and give meaning to a complex collection of individual facts and observations. Methods are the means by which we conduct those investigations in a reliable and valid way so that we can understand clinical phenomena. But it is the theory that lets us speculate on the questions of why and how treatment works. Theories provide the explanations for findings within the context of what it is that we already know from the successes and failures of previous investigations. As we continue to examine our observations, we try to create theoretical generalizations to form a basis for predicting future outcomes. Without such explanations, we risk having to reinvent the wheel each time we are faced with a clinical problem. Scientific theory deals with the empirical world of observation and experience and requires constant verification. We use theory to generalize beyond a specific situation and to make predictions about what should happen in other similar situations. The validity of these predictions can be tested through research. The purpose of research is to understand more about the elements of theory and to apply those elements to everyday practice. The role that theory plays in clinical practice and research is best described by examining the structure of a theory. What are the components? The essential building blocks of a theory are concepts. Concepts are abstractions that allow us to classify the things that we can actually observe with our senses, natural phenomena, and empirical observations. From birth, we begin to structure these empirical impressions of the world around us in the form of concepts, such as mother, father, play, or food, each of which implies a complex set of recognitions and expectations. We develop these concepts within the context of experience and feelings, so that they meet with our perception of reality. We supply labels to these sets of behaviors, objects, or processes that allow us to identify them and to discuss them. We use concepts in professional communication in exactly the same way. Even something as basic as a wheelchair is a concept from which we distinguish chairs of different types, styles, and functions. Almost every term we incorporate into our understanding of human and environmental characteristics and behaviors is a conceptual entity. When concepts can be assigned values, they can be manipulated as variables so that their relationships can also be examined. In this context, variables become the concepts used for building theories and planning research. Variables must be operationalized and defined. That is, the methods for measuring or evaluating variables must be very clearly delineated. Some concepts are observable and easily distinguishable from others. For instance, a wheelchair may not be confused with an office chair. But other concepts are less tangible and can be defined only by inference. Concepts that represent non-observable behaviors or events are referred to as constructs. Constructs are actually invented names for abstract variables that cannot be seen directly but are inferred by measuring relevant or correlated behaviors that are observable. An example of this is the construct of intelligence, which is one thing you cannot see, yet we can give it a very clear meaning. We evaluate a person's intelligence by observing his behavior, the things he says, and what he knows. We can also measure a person's intelligence using standardized tests, and we use a number to signify intelligence, so that an IQ score of 125 tells us something about that individual, but the number itself has no empirical value. We cannot observe 125 intelligence points like we can observe, say, 125 degrees of joint motion, but constructs can often be manipulated as variables in psychosocial and behavioral research. Once the concepts that relate to a theory are delineated, they are formed into a generalization or a proposition. Propositions state the relationship between variables, which can be described in several ways. So you might have a hierarchical proposition, which shows somewhat of a vertical relationship, and it establishes an ordered level of concepts. An example of this might be Maslow's theory of the relationship of human needs to motivation. A quantitative proposition is based on the frequency or duration of a specific behavior. For example, theories of fatigue are partially based on the concept of, say, repetitions of exercise and how exercise relates to muscle endurance. A temporal proposition orders concepts in time and states a sequence of events. So, for instance, many of you are familiar with the trans-theoretical model, which explains behavioral change as a process along a continuum of motivational readiness. And this has 5 stages: pre-contemplation, contemplation, preparation, action, and maintenance. So rather than seeing change as a unidimensional act, such as simply quitting smoking or starting to exercise, this model suggests that individuals progress through a series of stages in recognizing the need to change and finally engaging in a new behavior. Then we come to models. Many of the concepts we deal with in a professional practice are so infinitely complex that we cannot truly understand their real nature. In an effort to understand them, then, we try to simplify them within a context of a model that actually serves as an analogy for a real phenomena. So to understand the concept of an atom, it's helpful to scientists to delineate a conceptual model that's similar to a solar system. The intricacies of genetic processes were clarified by the development of a model of DNA, and so on and so forth. So those are the components of theories. Clinicians actually engage in theory testing and development on a regular basis in practice. Theories guide us in making clinical decisions. Specific therapeutic modalities are chosen for treatment because of expected outcomes that are based on theoretical assumptions. Treatments are modified according to the presence of risk factors based on theoretical relationships. Therefore, the theory is tested each time the clinician evaluates treatment outcomes. When a theory is used as the basis for a treatment, the clinician is, in effect, hypothesizing that the treatment will be successful. If results are as expected, the theory has been supported. When evidence is obtained that does not support a theory, or that cannot be explained by the theory, alternative explanations must be considered. There may be many reasons to question how measurements are taken and how concepts are defined, to determine if these are truly consistent with the theory's intent. The validity of the theory may be questioned, or the application of the theory to the specific problem being studied may need to be reevaluated. It may also be necessary to re-examine the theory and to modify it so that it does explain the observed outcome. If this is not practical, a new theory may need to be considered that will encompass this and all previous observations. So in posing a conceptually based question, you have to know that you are using this model of scientific thought, and that you have to try to make your observations empirical and to do that in a way that will allow you to at least describe what is otherwise unknown. You may also pose conceptually based questions about known observations that will allow you to organize those observations as facts, and those facts may be actually amenable to testing. And so in the testing phase, we would actually propose some relationships. We would try to explain these relationships. We would test these relationships and try to use these relationships to predict what we might see in a different situation or a different context. Now here's a nice little diagram that I think really goes far to explain what I just talked about. If you look at the box that's on the bottom of the screen that says identifying facts, this is basically where we're starting when some phenomena is unknown, had never been seen before, or we find that it's not adequately described. And so we would use an empirical approach in a descriptive type of situation to identify those facts, to describe them, to classify them, to compare and contrast them. And we're largely using an inductive process here. We're saying that we are looking at what we can see and what we can observe, and we're trying to use that information to derive larger theories. In order to do that, you would move clockwise up to the next box, which is to begin to propose some relationships among those facts. We do this all the time as clinicians. We see things that are new to us, and we begin to speculate about how those observations may be related or what they might mean. We're using an inductive process. Then as we continue along, we get up to the top of the circle, and we begin to think about whether these relationships actually explain anything that we're seeing. So can we begin to talk about how these relationships are associated together, how one thing might actually be correlated with another? And we're not talking cause and effect here yet. We're actually just saying, do these relationships explain anything that I'm seeing in the clinic, and how? And then as we continue along in our research process, our scientific thought, we actually move over to the deductive side of the equation, and we begin to think about whether what we are seeing in a larger picture actually can be used to predict what's happening on an individual basis. And here we begin to test relationships for their cause and effect. And this is where we get into some of the causal questions that you're going to be posing in this class. So we test those relationships. Does A cause B? Does A cause B only in the presence of C? What's actually happening here? And then finally, in order to complete the circle, we use those relationships in order to be able to continually identify more facts. As we actually apply those theories in the clinic, more facts will begin to reveal themselves. You'll find that questions lead to other questions, and this is the continual spiral of the research process. So how do we put all this together? and to think about how it relates to what you're doing right now in this course. Basically, you have been taking a look at the state of the literature. You've been trying to understand what the evidence suggests. And the state of the literature may be just at the point of identifying facts. It may have moved beyond that to proposing relationships or actually testing those relationships. So you should think about where the literature is, where the gaps are, and to begin to understand what your questions need to be able to do in order to advance our understanding in a particular area. Also think about what theories are being used by the authors in the articles that you're reading and how are they using those theories. It will give you some insight into how you might be able to use theories in the studies that you will be proposing. Also think about what needs to be defined or operationalized using theory. Oftentimes, we run into trouble when we don't do a good job with this operationalization of our variables based on some sort of conceptual framework. So the variables, their relationships, and the underlying model for the phenomena being studied have to be carefully defined using an established theory in order to use that theory in clinical research. So have a great week, and I'll talk to you soon.